Hi to all the friends of Back in Motion Bayswater. I thought I'd give you an update on the recent COVID-19 Stage 4 restrictions and the advice that the allied health practices have been given by DHHS. Firstly, I'd like to acknowledge the stress and hardship of these restrictions that they've had on our community, in particular the physical, mental and financial health, and I wish everyone our love and support. Well, it certainly has been a busy week working through all the information coming out of the various government bodies and professional associations. As you can understand, all industries have had these critical guidelines that they've required significant clarification over the last 4 to 5 days. Well, we believe now that we understand these implications of the advice, what we can do, what we can't do in these restrictions. I'd like to say that we fully support the Stage 4 restrictions under the government state of disaster. This was enacted to restrict the movement of Melburnians in order to control the spread of the coronavirus, and we're committed to that. So all non-essential travel of work must be ceased. We must not travel outside the 5-kilometre home radius and stay home after 8 p.m. We are taking these government advice very seriously in order to keep us safe and to reduce the spread of the virus within the community. In saying that, we also take the health and the well-being of our clients equally as seriously. So keeping this in mind, we'll endeavour to balance the healthcare needs of our client and the community with the efforts of keeping the community safe. So what does that mean for the practice and for you as clients? Well, Back in Motion Bayswater is considered an essential medical or health service, and it is permitted to continue to operate with a COVID-safe plan. Patients do not need a referral from their GP, which was the initial advice from the DHHS, and this is a great thing to reduce the burden on our GPs. However, the DHHS is very clear that we can only treat under urgent cases that are likely to result in an escalation of treatment without care. This means if you don't get treated in the next 5 to 6 weeks, is there a risk that you will need to attend a specialist appointment or a hospital emergency department, or will it prevent you from performing your essential activities of daily living? If this is not the case, then maybe we can delay the treatment till after these restrictions, or maybe we can do treatment over telehealth. We are not permitted to treat anyone for non-urgent conditions that can wait for 6 weeks. But we are committed to continue the care of our clients during this period. I realise it's difficult to predict what is essential and what is not, and so that's why we're here to help guide you. We'll have a conversation with you at your next appointment or over the phone in the next little while to work out what is the best option for you over the next 5 to 6 weeks. We will collaboratively discuss with you the appropriateness of your ongoing face-to-face care, as well as other options that are available throughout this period. We have introduced telehealth into the clinic, as I said, and this has had great effect. We're able to catch up with you over Zoom or over the phone and continue your care remotely. Telehealth has been shown to be a really effective way of managing people's injuries and pain. We also know that we're also looking to provide remote online classes so that you continue with your exercise programs and stay fit and strong. We're planning to do this on a Monday and Wednesday mornings and Thursday afternoons, and probably with demand we'll increase these as well. These were a great addition into the first wave of these restrictions that were taken up really well. So finally, Back in Motion Bayswater will continue to operate throughout the Stage 4 restriction period to ensure that our community can access the care that it needs. The difference will simply be in the delivery of the service, whether it will be face-to-face or via telehealth. These decisions will be made in consultation with you so that everyone agrees to the essentialness of the treatment and the way that we deliver your care. Our aim is really absolutely to ensure that you continue to get the care that you need. For all those clients with bookings, expect to get a phone call over the next few days to discuss your treatment plan. Remember, this is only for 5 to 6 weeks, after which time we are really looking forward to returning to normal and giving you the great experience that you've all known about with all our usual services. We do understand it is very difficult and it's a stressful time for our clients and our staff, but we also know that we need to be strong and committed under these restrictions. We have the most supportive community possible to get through this together and to come through the other side stronger and more resilient with a really better, positive look on life. So from all the team at Back in Motion Bayswater, we look forward to seeing you and speaking with you in the next couple of days. Thanks.